All right, when talking about the anatomy of long bones, this actually is a humerus. This is a real humerus that we had here in storage. So it does look a little different. When we talk about the anatomy of long bones, the expanded ends are called the epiphysis. You have your proximal epiphysis and your distal epiphysis. Now the shaft of the long bone is called the diaphysis. Now the connective tissue that surrounds the outside of bone is called the periosteum. If we were to look inside of this bone, we could actually see a medullary cavity. The medullary cavity is within the diaphysis. This would be the location of where you would hold yellow bone marrow. Now in the expanded end of long bones, you can actually see spongy bone if you look really closely. Spongy bone is going to basically reduce the weight of bone, but it's also going to store red bone marrow in the epiphysis, which is the site of hematopoiesis, where we produce red blood cells, white blood cells, and platelets. So we do have two types of bone marrow. Yellow bone marrow, which is in the diaphysis, is going to store triglycerides, which is fat, and red bone marrow, which would be found in the epiphysis, is the site of hematopoiesis. When looking at the anatomy of long bones, we can see both types of bone tissue. This outer bone tissue is made up of compact bone, which is going to reduce twisting, so you can't just break this or break it in half. It resists all shearing forces. That's compact bone. It makes out the outer wall of the diaphysis, but when you look at the inner portion of the epiphysis, the spongy bone, it's also called cancellous bone, is going to reduce the weight of bone, but it also functions to house your red bone marrow.